Assalamu alaikum. Hello everyone. Peace be on you all. I pray that you're all blessed with good health and lots of happiness. Ameen. Welcome back to Naila'z journey. Today I'm going to be talking to you about cancer awareness. I'm going to be covering breast, bones, lungs and liver, because these are the four aspects in which I have had experience in. So I wanted to share with you the symptoms that you all must look out for, and if any of the symptoms you notice, you must take swift action. If we react quicker, then there are more chances of having a successful outcome from the cancer treatment. I'm also going to be providing with some website addresses in the description, which you can visit in your time and have a read through them. So I'm hoping it would help you get more details about the symptoms and what steps you need to take when you do find the symptoms are happening to you. It is very important that we are very aware of what's happening to our body, the changes that are taking place in our body, which are not what we intend. So if you're losing weight, but you're not actually dieting or planning to lose weight, then that's something you must discuss with a pharmacist or your GP, your local doctor. So these are the kind of symptoms we need to be looking for that we're not intending to happen to our body. For breast, we need to make it a routine to perform self breast examination. If we keep performing the breast examination on ourselves like a normal routine that we do every day with ourselves, such as waking up in the morning, brushing our teeth, washing our faces, getting dressed, and if we make that examination part of that routine, it will be so much beneficial to us. We need to learn to look and feel our skin, our breasts. We need to examine the breast area, and we need to examine the area under the arm, the armpit, because this is where the lymph nodes are, and if there is cancer, it can spread here. So you need to check this whole area up to here for the symptoms that I'm going to be mentioning to you in a moment. The changes that you need to look out for are change in shape of your breast. So one may look bigger than the other, or one's gone up and one's gone down, or one's gone in from the side and the other one is just fine. If there's any discharge from the nipple, which is not milk, if there's blood discharged from the nipple, if the nipple has gone in, if there is a rash around the nipple, if there is crusty skin around the breast area or the edges of the breast, if there's any pain and discomfort. Sometimes we notice pain and discomfort and change in shape during our menstrual cycle, If you notice that change during your menstrual cycle, it is best that once your menstrual cycle is finished, you re-examine your breast to see has those changes settled or they're still there. If they're still there, then you must seek professional advice straight away. We need to get into a habit of noticing changes in our body and taking appropriate action. With the lungs, we need to look out for coughs that are taken over 2 to 3 weeks and still haven't settled. We need to look out for breathlessness. So normally if you're running around the house or on a track somewhere, you're getting out of breath. That's normal because you're exercising, you're being very active. But if you're just running out of breath, becoming breathless, just walking from one room to the other, or just simply washing dishes maybe, or just doing a short task, then that's something you need to look out for. You need to look out for pain when you take a breath or when you cough. The pain can be around the chest area, so you will feel more pressure around the chest when you cough or take a deep breath. So this area as well, the diaphragm. You will feel fatigue even though you haven't done anything. Maybe during the day you just still feel tired, exhausted unnecessarily. You're losing appetite. You're not being able to eat. You're hungry, but you can't eat. Or when you're eating, you're struggling to take breaths. You're losing weight when you're not even trying to lose weight. Your face and your neck is swelling. This is the kind of symptoms you need to look out for. With the bone cancer, if the cancer has spread in the bones, the symptoms that we need to look out for: tenderness around the bone area, weakness, fatigue at the touch of maybe the bones in your hands or your legs, arms, wherever it hurts. With the liver, the symptoms are similar to the lungs cancer symptoms. Again, being breathless, feeling weak, fatigued, loss of appetite, feeling nauseous, vomiting, yellow discoloration of the white areas in your eyes, itchy skin, all those symptoms that I talked about for breast, lung, bone and liver. I experienced all those. But I reacted very late in some cases. With my breast cancer, I did not know what were the symptoms of breast cancer that I had to look for. I did not do self-examination of my breasts, which is why when I had pain and discomfort in my right breast, I just ignored it, thinking it's just the usual, probably because of the menstrual cycle. That's why my breast is tender to that touch. Only when my nipple had gone in and there was a 6 centimeter bump or lump on top of my breast, that's when I knew something was wrong. With the lung cancer, the breathlessness, I was feeling breathless for a month before I went to see the doctor, and I kept ignoring my breathlessness and blaming that maybe because I'm not doing any activity, I'm putting on weight, maybe that is why I'm feeling breathless. I was vomiting, my eyes were turning sometimes yellow, the white area of the eyes was turning yellowish color sometimes. I wasn't eating, I started to lose weight, and I was getting treated for viral infections instead by the doctor. So because I didn't know about lung, liver and bone cancer symptoms, it took a few months to actually be diagnosed. So it is so important to please, when you feel there is a change in your body that you didn't want, or you weren't working on it, you must seek professional advice. If you feel there's just pain, or if you think there is a bump in the breast, sometimes it can be nothing. That's brilliant. Sometimes it can just be like a benign cyst in the breast. But it's always best to get it checked out. You can contact your GP, your local doctor, and they can give you an urgent appointment straight away once you explain, this is what I've noticed, and they'll do a proper professional examination of the area or of your body, and then they will decide what exactly is happening to you or isn't happening, and then they will take the necessary steps that need to be taken, either by referring you to a professional consultant who deals with that area, or it'll probably be nothing and you just get sent home, which is good. So the key is look and feel your body, your skin. Understand the changes in your body and react as quickly as possible. Don't ever panic, because panicking will then make things worse. It'll make you confused, and it'll make the other who you're trying to explain to confused as well. So stay calm, but just take the right steps. If you have any more questions that you would like to ask, please feel free to leave a comment and I'll get back to you as soon as I can. Thanks for tuning in.